A P3 is really just another term for privatization. In a P3, they'll take the hospital or the school or the water system. Private companies will build the infrastructure, so build the structure itself, and then they'll lease it or sell it back to the public authority, the school board or the water board or the hospital board, at a profit for 25 years, sometimes 30 years, sometimes 60 years, or even longer. In the case of toll roads, for example, 99 years. So really what they privatize the building, the financing, and some range of services, sometimes the full operations, sometimes a portion of the operations. So the difference between this and what's happened to date is that through the last century of history of building our communities, our local governments or our local authorities would build infrastructure as a public good, as a public service, and they would be run on a non-profit basis. Now, this new introduction of P3s is really a stepping stone to full privatization, but they themselves can contain significant privatization of services and financing and control over our public services and their infrastructure that we've never seen before. So never before have we seen 30-year service privatization contracts for water systems or schools or hospitals. Never before have we seen private financing by multinational banks or profit-seeking companies that then run our services for 30 years as a profit-seeking venture for their investors. That's brand new. The multinational consortia, which are the groups of companies that are pushing P3s, and forces in government that are supporting them, really defend their idea as this. They say, look, governments can't afford public services anymore. We can't afford to build $8 billion worth of hospitals or $30 billion worth of water systems or what have you across the country. And so we have to go to the private sector to do it. That's one argument. Another might be that we gain efficiencies from going to the private sector. Another one that they use is this isn't privatization. They try to pretend actually that there's no privatization in these deals. And then they use a variety of euphemisms or different words to cover up what they're doing. So they call them public-private partnerships as opposed to just privatization, or they call them private finance or alternative financing, or the merchant model I just heard they're starting to use in Nova Scotia, for example. So a whole variety of euphemisms for changing over who is building these things and who controls them then for the next generation. And none of these arguments actually holds water. On the cost question, and this is a fundamental question, one would expect that we should try and find value for money when we're building a public infrastructure, and that if it's more expensive to do it a certain way, that we should have a good reason for that if we're going to go that way. Well, in these deals, the cost is significantly higher. So much higher, in fact, that it leads to cuts in services. So it puts extra demands on scarce public dollars, and there's nowhere else for them to go except to shrink the service budgets. And because in these deals you've signed off the facility and its services for 30 years, sometimes 60 years, the local authority no longer has budget control over the whole facility. The only way that they can save money is by cutting the services. So in hospitals, for example, in order to save money, because of the high cost of financing, they cut the doctors, according to the British Medical Association Journal, 11%, nurses, 14%, support staff, up to 38%. So enormous cuts in the clinical services and patient services in order to fund the higher costs of the finance. And the reason that the finance costs so much more is that the private companies borrow at higher rates than government do. They're a higher risk, and you pay for risk. So there's a higher interest rate for them. In addition to that, there's all kinds of profit taking. Middlemen, lawyers, consultants, all of these people who are making money off of these deals. So on the cost issue, there's no question, even government forces that are pushing P3s, even the companies pushing P3s, can no longer credibly say that they cost less. One of the major problems with public-private partnerships is the loss of control over our public services. And this should matter to all of us because it's dramatic and it happens in ways that we haven't necessarily anticipated. So, for example, in the Nova Scotia schools P3s, once the schools were handed over to the private sector consortia to own and operate for the duration of the 20-year deals, the students weren't allowed to, for instance, pin things to the walls. Using the schools after hours required exorbitant charges. The usage of the playground resulted in extra costs for the school board to fix the playground, and ultimately led to legal wrangling between the for-profit company that runs the school and the public school board whose job it is to try and get services out. So, for example, in the Halifax school P3, they found arsenic in the water system. The school board took the consortium to court. The consortium is supposed to be providing the physical plant and its services for the duration of the deal, wouldn't do it, so the school board had to take them to court to try and get a settlement. For a year, students and teachers were forced to drink bottled water at the school board's expense while they fought it out in court. Because at the end of the day, the contract runs the public service. Whatever's negotiated in there, whether you've foreseen the technological change or what have you for the next 30 years, that contract runs the building. And these are multinational companies who have the experience of negotiating these across all kinds of countries, know exactly what they want to get in there in terms of it's not in their interest at all to pay for the building, give up all the control over it, and do it somehow more cheaply than anyone else would do it. It just fails the test of common sense.